Okay, we're going to be placing our Optragate. So I've wet it a little bit so it slides in here. This is a really nice device to be able to retract the lips and cheeks. So I'm gonna have my patient open big. I'm gonna slide in one side, slide in the other side. Notice how I've pinched it together so it slides in. Then we'll slide the device past the lower teeth down into that vestibule there. Then we'll do the same thing on the upper. And this helps retract the lips and the cheeks and keep the patient comfortable from anything that could possibly injure their lip or their cheek. So once that's in, we can add the Isolite or Dryshield. And we're gonna fold this into a ball. It's kind of big going in. Patients feel that it feels big, so we wanna prep them and make sure to tell them that they're gonna open wide, and it may feel big going in, but once it's in place, it will be fine. You wanna avoid the palate when sliding this in. So I'll roll it up into a little ball and go in on the side. So go ahead and open big and get its teeth here on the bite block. Good. So now the teeth are there. You can rest on that, and we would go ahead and turn this on. It's going to suction up everything. And then we'll place our cotton rolls. So for the lower, we can place on the buccal for mandibular and on the lingual. So we can place our cotton rolls in here, and this will help keep everything nice and dry. This is a lot of isolation. You may only need cotton rolls, you may only need, one of them. However, you can use all three if you really need some, depending on the case you're working on. Slide that one up there. When you're placing cotton rolls, you want to make sure they're not popping up and they're sitting in that nice sweet spot down in the vestibule or down underneath the tongue. To remove all of this, you want to wet your cotton. Just because if it's dry, it can stick to the tissue and it's going to be uncomfortable for the patient. So I go ahead and make sure these cotton rolls are wet, the ones that aren't saturated with saliva, and just remove those, making sure that when you're using the cotton pliers, you don't injure the tissue at all. Take these out. And then for your Isolite, it would be on. You're gonna take it out when it's still on so that it sucks up all that ropey saliva, and you'll just pull that straight out. And then lastly, for our Optragate, we'll pinch it together like we did when we pull it in and just gently pull that out. You don't wanna be too quick because it can splash you. So just go there. And that concludes our isolation demonstration.